Dr. Moser, how has COVID-19 impacted the transplantation process? Kidney transplant surgeries and surgeries for living kidney donors.
Yeah, I mean, this past year and a half has had a tremendous impact on everybody on this planet, but it's presented some very specific challenges to people with chronic diseases, with chronic kidney disease, and people with transplants. And the thing we got to remember is when somebody receives a transplant, not just a kidney transplant, any kind of transplant, they're all started on immunosuppression medications. And those are medications to, bring down the immune system so that the immune system is less likely to attack that new organ. So there's less chance of rejection. And the trouble with being on immunosuppression is it leaves a person more open to serious infections, including COVID. We've seen that COVID in people on immunosuppression is very serious. And when the pandemic was first emerging, nobody really had experience dealing with a pandemic because transplantation hasn't really been around for that long. Nobody really knew what the right way to proceed was, and we saw programs completely close down and not do transplants for about 3 months. We saw the other end of the spectrum where a lot of programs continued, say, business as usual, as they say. And then I think our program, we kind of took an in-between approach. And by just watching and learning more about the disease, seeing what was happening, very soon we realized that, we're already very cautious when it comes to preventing infections in our transplant patients. And, on top of that is the fact that transplant patients, they're already stars when it comes to hand washing, to their own form of social distancing, to reducing their risk of infection. And so very soon, as soon as we safely could, we got back to being fully open again as a transplant program. Trouble is between a combination of programs closing down for safety and probably a reduction in the amount of donation and living donation surgeries. In Canada anyway, in 2020, there was a decrease by 20 to 30% in the number of transplants that took place. And, we're open again now, but, we do always have to be careful and see what's coming up, being adaptable and ready to adapt to whatever comes up.
I appreciate that. That's great information. And, I remember after my transplant, 2 years in, I went on my first international trip and I wore a mask on the plane and I was so embarrassed. I was probably 27 years old and I was like, why am I wearing this? But nowadays it's the new norm. So, it's just how times have changed. So thank you.
I'm all for it. I think I'm going to have a hard time getting on a plane without putting a mask on,
Yes.
Here on in, pandemic or no pandemic.
Dr. Moser, I'm curious for those that have tragically passed away from COVID-19, is the transplant program able to save those kidneys and donate them to those that are waiting on the transplant waiting list?
Yeah, that's a good question. A lot of people have been asking that very question. And I think the simple answer is unfortunately no. When it comes to transplantation, there's not a lot of absolutes, but two of the absolutes are that one cannot transplant organs that come from somebody with active cancer or with active infection, because essentially you're spreading the cancer or the infection to that person, to the recipient. And that would include infections like COVID. Obviously, if somebody had COVID 3 months before and, unfortunately passed away from something else in the meantime, then, that would be fine for transplantation. But if there's active infection and that was the cause of death, then unfortunately, those organs cannot be used.
And I also have one other item that I've heard, and I'm just curious if you could answer this as well. For deceased donation, if someone passes away outside of the hospital, are they eligible to become a donor? Or I've heard they have to pass in the hospital.
I think you're right. It has to be done in the hospital. As soon as a person's heart stops, the organs are no longer getting blood supply, they're no longer getting oxygen or glucose. And so the cells in the organ very quickly, within 10, 15 minutes, the cells in the organ are dying off. So you're absolutely right. It has to be in a hospital setting that they pass away.
If someone is interested in learning more, becoming a living kidney donor, what are the first steps? And can anyone be a donor?
I mean, I think to answer your second question first, anybody can inquire about being a donor. I think there's all too often the opposite is true, where people will assume, they'll say, I'm too old to be a donor. Nobody wants my kidney. After all, I'm 55. That's far from the truth. So, I think we'd encourage people to look more into it, to make the call to the local donor coordination program. And there's a screening questionnaire. Very quickly, you can find out if it's possible you might be a donor or if it's really out of the question. These days, you can find a lot of information on the internet. The challenge is finding good information, truthful information. I think we can safely say that the Kidney Foundation has excellent information about living donation, but generally in your local health authority, at your local hospitals, they have websites too that generally have very good and very truthful information to you.